Hey, welcome. My name is Dr. Karen May, and today, new name. It's Everything Neuropathy. We're trying to put some series together, and this one is around February, and I was thinking about February and heart and looking at the microcirculation aspect of it. But then what I realized is I've had quite a few people coming into our clinic who have medication-induced neuropathy. And what I realized that one of the most common ones are statin drugs, so the heart. So I figured I would jump in and talk about medication-induced neuropathy and give you a little understanding of how to ask your doctor what is necessary to move forward. Like I tell you, everything is great information, so I am not telling you to stop any medications. That is not my position. This is for educational purposes. But if you're on some of the medications that I'm talking about that some of the side effects are neuropathy, it's worth having a conversation with your prescribing doctor to see if you can reduce them or what you can figure out, so that way you could see if it is part of your journey with neuropathy. But we've said this numerous times. There's over 100 different causes of neuropathy, and one of them happens to be medication-induced. So we see people with chemo-induced neuropathy, and so great, they're here, they're alive, and we're ecstatic that someone has a life, but the quality of life, because they can be riddled with neuropathy. And unfortunately, that's not well treated from the oncologist or even the neurologist. Is just more medication usually. So it still leaves people with a quality of life. Statin drugs, again, can be very beneficial for some people, but side effects aren't just neuropathy, but it's excessive leg issues and aches. So some people can't take them, or if they're taking them, they're at a dose that's causing symptoms, but yet according to their blood work they look normal and that it's healthy, though again quality of life is not there. So is there other things that can be done to reduce some of the risk and also help to stop the progression of neuropathy and the effects on the quality of life? So in looking everything up, I went to, I think it's called Foundation from Peripheral Neuropathy, and I counted 27 different medications. And there's a whole list. I literally just Googled medications that can cause peripheral neuropathy to try to find a very simple list. But there's medications on here for abnormal heart rhythm, cancers, bacterial infections, autoimmune disorders, gout, skin conditions, alcohol addictions, high blood pressure, rheumatoid and psoriatic arthritis, urinary tract infections, seizures, heart rhythm, let's see, HIV and other infections, lupus, and then to lower cholesterol. So that's again, there's antibiotics that are on there that can cause it. So when we get a medication, the doctors are recommending it because they're thinking it's necessary. It is also your job to understand the effects it can have and have that discussion with your doctor. So the best place to ask for the side effects of your medication is your pharmacist. So you can go online too, but we're not talking like all the pieces of paper that they give you when you're getting your prescriptions. Those, but you don't just look at the kind of the first pages. You got to dig a little bit. But neuropathy, which is that numbness and tingling, it feels like chronic pain and numbness and tingling, can be caused by these medications too. So I don't want you to think that there's nothing that can be done and that it's only diabetes that causes neuropathy. So my action step for you is to take a look at your medications list and then literally ask your pharmacist for a list of all of the side effects, not just the common ones, because they have to give you a list of all the side effects, and take a highlighter and highlight the symptoms you're having. And if neuropathy is one of the causes, and plus other symptoms you're having, schedule an appointment with your prescribing physician and ask them, tell them you're having all of these side effects and what can they do to help you to reduce those side effects, or potentially change your treatment course. So that is the first step, and I would highly encourage that. But the second step is, if nothing can change, and this is the path that your doctors have for you, which is so common, sometimes you have to take it into your own hands, and your quality of life is worth it for you. So catch one of our webinars, understand what neuropathy is, some of the treatment approaches that leave you still suffering, and then what do we do? And the transformation program that we put people through who are seeing amazing results that are long lasting. So we would love to have that conversation with you if you're ready. So again, get that paper, those papers from your pharmacist, highlight the symptoms that you're having, and take it to your doctor, your prescribing doctor, to see what they can do. And if you get stuck, all you do is give us a call. We'd love to see how we can help you with your neuropathy. Don't forget, your neuropathy relief begins here. We'd love to hear from you. Have a great rest of your day. Bye.